any more time now. I will, if we're ready to hand over, I'm going to introduce, first of all, we've got Andrew Almerol, who's going to be talking about improving access to vascular access device care, use of QR codes and training videos.
Good afternoon. My name is Andrew Almerol, and I'm a vascular access clinical nurse specialist. I currently work at Bedfordshire Hospital's NHS Foundation Trust in Luton. I am delighted to have been chosen to present our poster abstract on the use of QR codes and training videos to improve vascular access device care. This year's theme of restoring and resetting IV practice is about sharing our stories at a very difficult time as we're emerging out of the pandemic. I find this is a common theme among several other posters presented here by our brilliant colleagues. Another that's proved quite popular is the use of QR codes, which I know one of this year's sponsors have put out a prize draw if you scan their QR code. This is in keeping with what I would like to share to you about our poster. Our team is small, with my manager, lead nurse, and British Journal of Nursing Vascular Access Nurse of the Year 2020 Val Wortley. We are involved in insertion of vascular access devices and training of staff on their use. According to Vessel Health and Preservation by Nancy Moreau, management of vascular access devices represents the largest portion of time in the VHP cycle alongside assessment, insertion, selection, and evaluation. It is said that the cornerstones to safe patient care and management involves using right infection prevention methods, including ANTT for handling the device, disinfection of access site, pulsatile flushing the device before and after infusions, performing dressing changes consistent with policies, and evaluation of device necessity with prompt removal when the VAD is no longer in use. We needed to find a way to ensure healthcare staff are able to do this. Training was significantly affected during the height of the COVID-19 pandemic. As with the whole world facing the brunt of the pandemic, the way everyone worked in our trust had changed. Staff had to be redeployed and had to be upskilled. There were new starters who required the usual preceptorship training. However, it was challenging to offer the usual face-to-face theory and practical training because of the restrictions in place and the need for social distancing. We were concerned that this is creating knowledge and skills gap among the staff. In a survey by Chawla et al. 2020 in Canada of medical residents and their training program experience through the peak of the pandemic, found that 70% of responding participants felt that their training had been substantially affected by the pandemic in some way. This prompted our team to think of novel ideas to deliver our training programs in the care of patients with vascular access devices. Web-based learning is found to effectively support learners' clinical learning process by offering additional virtual visual support. According to a study by Barson et al. In 2019 on the effectiveness of web-based learning in supporting the development of nursing students' practical skills during clinical placements, the learning gap between theory and practice can be reduced using web-based learning, and even as an upgrade for already qualified nurses. Instructional videos available in popular sites like YouTube may not be reliable educative materials. In a study by Sevink in 2019, that investigated individually uploaded YouTube videos for catheter insertion and removal, found that insertion practices are similar among different specialities, while removal procedures are varied. And according to an article by Topps et al. In 2009 that reviewed current literature, video-based applications are getting more popular, that they offer a valuable resource for learners of varying levels in practice settings. It aids in the performance of clinical skills where learners can preview a procedure and be familiar with certain maneuvers before proceeding with an actual patient. Our aim is to provide easily accessible training materials to support staff in their clinical practice and improve patient safety and satisfaction. Our solution was to produce bespoke training videos on the care of vascular access devices. First, we identified core clinical procedures, and we have identified them to be PICC dressing change, unblocking CVAD, CVC removal, and blood sampling from CVAD. There are procedural videos available in popular platforms like YouTube, but are not specific to the training needs and the practice in our institution. The only way we can make them bespoke to our needs was to make them from scratch. Armed with an iPhone and a bedside night lamp for lighting, we transformed our mini office studio in a mini studio. We did this because we wanted the videos to be of high quality and appealing. With very basic video editing skills and the magic of iMovie, we were able to produce training videos and upload them onto our staff intranet. The videos were reviewed for validity of content and overall quality of video and audio. These videos can be accessed using the Trust computer, but some of the issues we found were around ease of accessibility. There were a limited number of computers available to access the staff intranet. We looked to see if the Trust-issued iPods and iPads used for electronic health record can be an alternative, but the link to the online resource was very problematic. The solution we came up with was the use of QR codes. QR codes were invented in 1994 and is a type of a matrix barcode which could contain data for a locator, identifier, or tracker that points to a website or application. QR codes are often used in augmented reality, displaying multimedia content, QR code payment, website login, and restaurant ordering, among many. The popular NHS track and trace scheme widely used the QR code scanning. Scanning the QR codes with the use of a mobile phone allowed staff to view above videos for visual reference. QR codes were generated with a free third-party web application, which also allows counting the number of scans. The use of QR codes and mobile phones was consulted with IT and information governance for compliance. The QR code posters presented to the corporate nursing and ward managers for information dissemination. We have identified that clinical areas such as the locked treatment room is an ideal place for the posters. Since going live in the first 30 days, there has been 94% increase in the total number of scans for all QR codes combined. To this date, there have been a total of 390 scans for the 6 QR codes linking to the videos. Feedback has been positive, with staff saying it is a brilliant and convenient way of accessing training videos. The team regularly promotes the poster contained in the QR codes during regular staff engagement or during trainings. We believe we can increase traffic by actively promoting and raising awareness, as well as ensuring clinical areas display the QR codes for easy accessibility. The team still conducts regular vascular access training days for preceptors and new starters, and we believe that actual hands-on practice and competency checking is the optimal way of learning. But in these challenging times, the team would like to maximize the resources available to allow for learning. Furthermore, the team envisions future video applications to become interactive. In a paper by Charette et al. In 2009, which aimed to determine whether interactive videos could enhance learning experience in the field of health and safety, found that by making the videos interactive, learners can engage and have an active role. Such tools can be used to empower learners across settings at their convenience. With this initiative, other service areas duplicated the ideas, such as in pediatrics, with their common nursing procedures and clinical conditions, while others have expressed interest in creating bespoke training videos, such as practice education in accident and emergency and the nutrition team. There is currently a gap in the trust for creation of corporate-style training videos, whereas some other institutions may have this capability. The team was able to create these with basic computing skills, but recognizes that it takes considerable amount of time to shoot and edit the training videos. The main driver for this initiative were ideals of innovation, excellence in education, collaboration, and a sense of joint ownership in every aspect of this initiative. The team is unaware of a totally free QR code hosting platform or one that is subscribed to by the Trust's IT department. It would be beneficial to hold master classes on creation of training materials, such as videos for other areas who may be interested in doing the same. The team recommends a project manager who may have expertise and skill, as this project involves the use of technology. The use of QR codes allowed ease and convenience in accessing relevant training videos to support staff in their clinical practice. Training videos serve as adjunct to visual learning. In conclusion, our team believes that this, together with hands-on practical training, can significantly improve care of patients with vascular access devices. Thank you very much for listening.
Thank you, Leo. That was very informative. Coming up here, and I think this is aiming at Leo because it's, although Sue finished off with a QR code, I think this is aimed at your QR code rather than the drip QR code. And this is, I can see the pros and cons of QR codes for teaching, but worry colleagues with no knowledge of central lines will misuse the QR videos. Do you think this access to help videos will reduce your contact with the ward areas that might need some face-to-face training or assistance?
To be fair, the training needs of each trust and institution varies. I could understand where the question is coming from, but our institution is unique in where all new starters and preceptors, we capture them with our preceptorship training. So they would have, at some point in their journey of starting their careers, have an idea of what vascular access devices. We've adapted the use of the IV therapy passport, although it's mainly used in London, but because we're close proximately to the London area, we adapt that as well as part of the e-learning process. So we cautiously say that the videos are as a video adjunct. What we're trying to bridge the gap here was at the time when we couldn't get to our target audience, what was the answer? So this is the answer that we came up with. So yes.
Okay, thank you. Leo, I'm going to come full circle and go back to you if that's okay. I was very pleased to see, I'm not surprised that you've got a lot of positive feedback on your QR code route to the videos. And I think I'm right in saying that the data that you showed in terms of uptake of those was based on the app itself giving, or the QR code itself giving you access details. Do you have any measure of what percentage of staff that you were aiming at didn't access the videos? In other words, is it missing anybody? And I'm kind of thinking of, you know, in every workplace, we've all got colleagues who choose not to engage with technology and therefore might be missed by this. You're on mute, I think.
Thank you. Right. Yeah, I mean, certainly, I unfortunately haven't got any data on that. It's something that we would like to see moving forward with the project, collecting essentially proper feedback and exact information as to who among our service users are able to access those and what other comments they've got on the project. So yeah, it's something worth exploring in the future.
Yeah, thank you. We're coming up to